Good morning, and thanks for joining me. For those of you watching online, I'm at the Afton Fire Station, one of 5 vaccine locations that have partnered with the St. Louis County Department of Public Health. And thank you, Chief Nick Foss, for letting us come here today to give an update to the county on our vaccine distribution. And we'll be here. He'll also be able to make a few remarks as we move through the morning. We are pleased now to have a commitment from the state to provide St. Louis County with 3,000 doses per week of vaccine. And we'll be getting our next shipment of vaccine to St. Louis County Department of Public Health on Tuesday. This gives us the assurance that we need to continue vaccinating folks in St. Louis County along with our partners. It's good to see more vaccine going into our communities across the country and here locally as well. In St. Louis County, our Department of Public Health has vaccinated 11,000 of our residents and people who work in St. Louis County, and we have given 1,100 second doses of the vaccine. We are currently vaccinating Group 1A, 1B Tier 1, and 1B Tier 2. When more vaccine is available, we'll be able to open up more sites, and we'll be able to get even more vaccines into arms. Over the last several days, frustration over the vaccine delivery process in our country and our community has played out publicly. Who should administer it and how much? Who is doing what? And I get the confusion, and it's valid. But over the past couple of days, we've gotten more clarity. I appreciate the help from the State Department of Health and Senior Services. They're doing the best they can under difficult circumstances and have opened up communications with the public and stakeholders so we can all better understand the vaccine distribution process. I want to recognize the hard work of Dr. Garza and the Pandemic Task Force. We would be in a much worse position today if it were not for all of their work over the past year. We must be careful not to characterize any person or any particular group as a villain in this process. The vaccine is the villain. Talking about others doesn't do any good in the situation. The challenge is getting vaccines quickly distributed, as quickly as possible, and into the arms of people in our community to eradicate this pandemic. Anxiety is high and opinions differ. The demand for the vaccine supply still far outweighs the available vaccines. The indicators that the hospitals use to measure the depth of virus in our community are all improving. That's encouraging. It shows more and more people are following the public health guidelines and are working hard to protect themselves, their loved ones, and their neighbors. As a result, businesses in St. Louis County can now open to 50% of capacity, and that includes restaurants. But let's be clear, people are still getting sick, people are still dying. The vaccine provides hope, but only about 8% of folks in our region have been vaccinated. So don't let up. All the hard work that we have done is what's keeping this virus at bay and gotten us to where we are today. The hard work must continue as we get more people vaccinated in the coming months. And that's why partnerships such as this one with the Afton Fire District are so important. They've turned their community room downstairs into a vaccine distribution point. First, the focus was on first responders, and now they've been able to open it up to other people in the community. And today, with the help of our Department of Public Health from St. Louis County, the Afton Fire Protection District will give 300 vaccinations to people who've made appointments. So to provide more details about this partnership, I'd like to invite Chief Foss of the Afton Fire Protection District to make a few comments. Chief, you want to come up?
Thank you, Doctor. Thank you, Dr. Page. About 2 weeks ago, the Afton Fire Protection District, in conjunction with the Department of Health, began vaccinating residents, as Dr. Page said. It was done with no fanfare. No one was looking for accolades, but it was just about getting needles in arms. We obviously cannot do that by ourselves, so we have relied on the Department of Health from day one. But to put it in fire service terms, This is kind of like a major alarm that we're dealing with. And historically, we don't know when that alarm is going to come in, but we know that we have resources outside of our district. But we know what this challenge is. It's staring us right in the face. So up until today, we have done this all with our off-duty crews volunteering to come in and do that. But last week, we had reached out to the South area departments around us. And this morning, as you will see if you would like to go downstairs, we have firefighter paramedics from the Fenton Fire Protection District helping us. We have commitments from the Lime Fire District, the Valley Park Fire District, Crestwood, West County EMS and Fire District. They've all committed to come and help us with this process. We're still doing first responders. Last night I was contacted about 9:30 that there's a North County department that has 10 officers that weren't vaccinated, so we will get them in Monday as we're vaccinating all next week, as well as the 250 residents from the county that we'll do Monday as well. Lastly, I would just like to take a minute to talk about the St. Louis County Department of Health. This was a hard process for us to get this application approved, and we could have never done it by ourselves. It needed to be hard because managing the cold chain of the vaccines is critical to their being successful. So as they're doing today up in Pattonville on the first day, getting them kicked off, they were part of our process to get approved, and they were part of our process initially to get us up and running. But I feel like we're in a good place, and it's basically because of them. So to Ms. Ryan, who runs the Department of Health, I say thank you. I would also feel remiss if I did not give a quick shout out to Laura, Becky, and Emily at the Department of Health, because I speak with them daily, and they are striving to get needles in arms. Sometimes as late as 10 o'clock on a Sunday night, they would have called and said, hey, we just got approval for vaccines. Can you shoot arms Tuesday? So they do a great job. We could not have done it without them. And Dr. Page, you should be proud of your DPH. Thank you.
Thanks a lot. We'd be glad to take any questions.
Why do you suppose that there is so much controversy surrounding the vaccine process developing? And number two, how important is it to have sites like this becoming mass vaccination sites?
Well, I think there's controversy because there's frustration and anxiety about people getting vaccinated. We have very long waiting lists. We have people that have been waiting a year to get back to some sort of normal, and we've been waiting, we've been hearing about the vaccine for about 10 months. So there's just a lot of pent-up frustration and anxiety for waiting. There isn't nearly enough vaccine to meet the demand, and it isn't clear to everyone exactly where the vaccine is going. So we will review the information that's available to the Pandemic Task Force and to others, and try and understand and try and make sure that St. Louis County is getting their fair share of the vaccine, however limited vaccine, that's available to our state. And we'll continue to have those conversations. And I know the state Department of Health is working to improve communications so we can understand where that vaccine is going.
What's so important about having these larger vaccination sites like here in Illinois?
Well, first of all, we want to get the vaccine locations, the vaccine distribution out into the community as close to people as possible so they don't have to travel as far to get vaccinated. So our partnerships are important. To be in a partnership, we need a place, we need people who can give the vaccine, and we need vaccines. And right now the vaccines are the limiting factor, but our fire departments and our firefighter paramedics on our firehouses are natural partners because our paramedics can give vaccines. And we've been able to partner with our firehouses and use off-duty paramedic firefighters to vaccinate. And that's an important partnership. Pharmacies are going to be an important partnership. As the vaccine becomes more available, other doctors' office will be able to provide it.
Dr. Page, can you try to remember to repeat the questions you get just for people online who having difficulty hearing?
Okay.
Any plans to utilize more firefighters?
Yeah. Yeah, so the question is about plans to use more fire districts. I know that there are more in the application process right now. We're partnered with Afton and Melville and Eureka, and it takes a while to get geared up. The cold chain storage managing the vaccine and keeping it at the proper temperature takes some training and takes some refrigeration equipment. So there's a lot of process there. The Pattonville Fire Protection District is involved as well, and they're helping us with some of the mobile vaccinations, actually going out into the community and trying to get to people who are not mobile and can't get to a firehouse. So we'll see more partnerships. I know there's several other fire districts that are in the application process, and I would encourage more to apply.
And obviously, given the struggle of having a consistent vaccine flow, any concerns about maybe opening up too many places that can distribute but not having a pipeline?
Yeah, so the question is having too many places and not enough vaccine. So certainly to vaccinate, we need places and people to give the injections and vaccine. And we know the vaccine is going to become more available in the next 5 or 6 weeks. Right now, it's important to get these places open and get comfortable with the process and the flow and start working through the efficiencies. So when we do have more vaccine, we can scale up the places that we already have, and we'll be smoother at it, and we'll be better equipped and better experienced to open up new places.
Dr. Page, you have said in the past that, or you said today that you were promised the increase in the vaccines. In the past, you've been disappointed or that. What's your level of confidence that the state actually going to come through with the vaccines?
Well, one thing that's one benefit of this very public frustration and concern about St. Louis receiving their fair share of vaccine is that it's brought some attention to the process. And I believe that when the State Department of Health tells us that they have a plan now for us to get 3,000 doses a week, I expect that they will keep that commitment and those vaccines will come. St. Louis County could vaccinate a lot more than 3,000 people per week, but that allows us to keep the flow going, to get places like this up and running, and really get some people vaccinated, but also create a process and a system that will scale up very quickly when we get access to more vaccines. But we know that the vaccine supply will be relatively unchanged for the next 4 or 5 weeks, and then after that it should increase quite a bit.
Anecdotally, we have some teachers here, my wife's a 60-year-old teacher in St. Louis County, still not on any list to get a vaccine.
Right.
My daughter's a 24-year-old teacher in Illinois, already has the vaccine. When you have these two states right next to each other, when you see that discrepancy in the outrolling of the vaccine, how discouraging is that? What effect does that have when you see the comparison?
Yeah.
Because people in the metro area see what's happening and how effective it's been in Illinois compared to St. Louis.
And so the question is about vaccines and especially teachers, educators who in Illinois are able to get the vaccine, and in St. Louis County, in Missouri, because we follow the state guidelines in Missouri, teachers who are not high risk or not yet prioritized. And as we distribute the vaccine, we will work with the list and the priority that the state has given us with the limited doses of vaccines that we have. But it's certainly frustrating to look at other parts of the country where they have access to more vaccines and they're able to get more people vaccinated. But this is where we are. We're going to work through this as fast as we can. St. Louis County Department of Public Health has a big infrastructure, and we are getting people vaccinated, and we're prepared to vaccinate as many people along with our coalition partners and other people in the community like our health systems who are vaccinating. We're going to vaccinate people just as quickly as we can get vaccine into our hands, and we'll be expanding our partnerships across the community to do that.
With 3,000 doses a week, how long is that set to continue for? And are you confident from the reports that we're going to get them going forward?
I'm confident that we'll get at least 3,000 doses per week, and as vaccine becomes more available, I expect that we'll get more vaccine. And we're ready to, through our partnerships, we could give out a lot more than that. And if we get access to more, then we will. But, that's a minimum number that will keep us going. We have over 200,000 people on the waiting list. So we know there's plenty of people who want vaccine. And I would encourage people who are on our waiting list to also get on other waiting lists that are available in health systems to get on as many waiting lists as you can, but please only make one appointment once you have that opportunity, so you don't take an appointment away from someone else.
So 3,000 should be ongoing for some time?
Yes, 3,000 a week. Absolutely. We're getting those directly from the state. We believe that commitment will continue, and that will be a minimum commitment to St. Louis County, because as a high throughput vaccinator, we could do much more. Yes. So the question is about the mass vaccination sites, which essentially in other counties, which is essentially the National Guard sites, and I believe those are traveling throughout throughout the 11 county metro region and the rest of the state. They generally can vaccinate about 2,000 people a day when they do that, and the question is whether or not St. Louis County residents should try and get registered at those sites. You know, I know in St. Louis County, in order to get vaccines from the state, we have to agree to vaccinate anyone who registers with us. I don't know how strictly residency is enforced at those out-state or out of our region mass vaccination sites. I'm sure there's some flexibility, and they probably will give some preference to their local residents, but if residents from our county wanted to try and register for those sites, they could, especially if they live in those areas or work in those areas. Yeah, what up, Chief?
Obviously, what you guys do is answer the call, you know what I mean?
Just repeat
To have the opportunity to serve the community in a different aspect, what does that mean for you and your obviously partner?
Well, the question was, what does it mean to us to be able to serve outside of our normal realm of responsibility? And it's really an honor. And the reason I say that is I wanted to say to my prepared remarks, so thank you, is some of these people, when they have left, they've left with tears in their eyes, or we've had grandparents that say, I'm finally going to get to hug my grandchildren because of you. And it's really not because of us, we're just the face that they see. But it is so rewarding that, like when the Afton guys started doing this, I was a little afraid that they were going to get burnt out and not want to do this, but it's actually been the opposite. We're getting more and more people to sign up because just the joy that you get to see in someone's face when you give them that shot it's overwhelming, and I can't say we get as much out of it as they do. Thank you.
Chief, follow up to that, I mean, how important is it for you to be a part of it? Obviously, you guys obviously are excited here.
We are very excited to do it. We are thankful that we get the opportunity to do it.
Okay, any other questions? Doug? Okay, thanks a lot.
Yeah, just call and find out if we're allowed to. But specifically say, we don't want to be quarantined if we go down there. Because that's my concern.